So, examples of preprocessing. CDC, log compression. What's right magnification?
Right magnification.
Would it be
The zoom?
zoom? But when?
Before.
Before you
Oh,
get
before
frozen.
it's frozen,
Okay, so right magnification is zooming in before it's frozen. What about persistence?
Oh, temporal compounding?
Huh?
Temporal compounding?
No.
Is
Oh.
that what?
So let's, so let's keep it, let's say that's 4 pulses on our scale. Okay, for
Persistence.
right now.
Would
Okay,
it be like Apple Power or not?
like who?
Apple Power?
No, no, no. Okay, spatial compounding? What does it mean to compound something?
Different angles.
Like to put it all together?
Yes, okay, so to put several things together, right? A compound is putting at least 2 things together to make one thing, right? So, what are we compounding when it comes to spatial compounding?
The angles.
The angles. The angles in space, right? Okay, so it's gonna take an angle coming this way, an angle coming this way, and an angle coming forward. It's gonna put them together to make one better image, okay? We have edge enhancement. What do you think that means?
Makes it look sharper,
What makes what look sharper?
The image?
the image,
Would it be the,
the grace.
That's a great. Let the focus. You're on the right track. Okay, so edge enhancement highlights the borders or the boundaries between 2 different tissues. Okay, so it'll make the border more obvious. Okay, so this is beneficial when we're trying to rule out cysts or different types of masses. Okay,
is there a button for that?
yes, it says edge
Oh,
on the machine. On some machines, not all machines have edge enhancement, but most of them do.
does that affect bio effects?
No,
Oh, nice.
no, it just has to do with amplifying the echoes at those borders. Okay, so post-processing, any change after freezing the image, paint black and white inversion. Okay, so we could invert the black and white. Okay, we could make it look like an MRI if we wanted to. Okay, read magnification. What do you think that is? Zooming after you freeze. Yes. Contrast variation. Okay, so changing the colors on the screen, and 3D rendering. What is that? 3D rendering.
Like filter?
Huh?
Filtering it? Or kind of?
So 3D rendering is what we do when we get the 3D images of the fetuses. Okay, so what it's doing is it's taking a scan this way, it's taking a scan this way, and it's taking a scan this way, and it's putting all of those scans together to make a 3D image. Okay, but once you freeze it, once you freeze the image, it's gonna stay in that machine, or like the information is gonna stay on the machine, and then the machine's gonna interpret it to make the 3D image. Okay, you guys know what 4D is?
It's a video of the 3D image.
So 4D is 3D but live. Okay, okay, it's live. So every machine has 4D. So when they say we have 4D machines, like everybody has 4D machines.
Is it like a big difference from 40 to 3?
It is now. Now because you can actually see that the things moving. Because like the machines that they have now that have 4D capable for like the OD 4D functions, they're really nice. Where like you can get an image and it will look kind of similar to what the video looks like on your board. That's pretty cool. Like the 3D that I have on my G, we can't get those types of 4D images because it's really great. But the
What about the
images-
migrate?
the very, we don't have a 3D Pro for it.
When is it good to do a 4D?
So I would do the 4D in like the early trimester.
Oh, okay.
You said you don't have a probe for it, so you can get a probe for all the machines to do the 3D?
Yes.
Oh.
So right now, I'm trying to get a new curvilinear for the Samsung, which is a footprint style display. So that's priority, and then after that, I'll start to work on the, so, other stuff. Okay, so read magnification. What do we say that read magnification was?
It's a number before freeze.
After.
After freeze. After freeze. Okay, so just imagine that you're writing down notes.
Right?
Okay, that's live. That's live, right? Okay, so what do you do when you're done writing your notes? You pick it up and you read it. Okay, it's a signal machine. What we're doing live is we're writing. When we press that freeze button, then we read. Okay, so read magnification is magnification after it's frozen. Okay, so read magnification occurs after the image data has been stored in the scan converter. It consists of 3 steps. The ultrasound system scans the anatomy. The image is converted from analog to digital form and is stored in the scan converter. The sonographer identifies what's ROI,
Regions of interest.
region of interest, and the system reads and displays only the data that pertains to the region of interest. Okay, so we've frozen the machine, now we twist,
Let's see.
now we twist the zoom in now, okay? So this was our first image, but we decided to zoom in on the face. Why does it look pixelated?
The resolution's down.
The number of pixels.
Okay, so the number of pixels didn't change. Okay, so all we did is we took these pixels that have the limited colors or the limited shades of gray and that size, and we made them bigger. Okay, so now we're seeing the actual size of the pixels. Okay,
That's
and the
right.
different shades of gray. Okay, so the read magnification is characterized by the number of pixels or scan lines in the magnified image. Spatial resolution doesn't change because the number of pixels in the, because the region of interest does not change. Okay, so this means that this is the actual spatial resolution. We just happen to zoom in on it, and we can see how big the pixels are and the shades of gray within each pixel, right? But if we zoom back out, it looks normal here, right? Okay, now what's the opposite of read magnification?
Right.
Right magnification, okay? So what do you think the difference is? Right is before?
And read is taken after.
No, well, yes, but what do you think the difference is in the image?
Oh, right, has a better,
It has a better resolution because when we zoom in live, we change the number of pixels that are in the region of interest. In this one, we took the pixels already and we just made them bigger.
Yeah.
Okay? So with right magnification, it consists of 4 steps. The ultrasound system scans the anatomy and creates an image. The image is converted from analog to digital and is stored in the scan converter. The sonographer identifies the region of interest. At that moment, the system disregards all the data in the scan converter and then replaces it with the new data, which is in this region of interest. Okay, so what it's saying is that instead of having to process, there you go. Instead of having to process all this information, okay, once it's frozen, and that's why the pixels remain that same size, the right magnification gets rid of all of this unwanted data and focuses on this region of interest, and it gives that region its own pixels, okay? Which is how we get this clear image right there. Okay, so the number of pixels or scan line in the region of interest is greater than that of the region of interest portion of the original image. Okay, so there's gonna be more pixels and more scan lines in this area than there was altogether in this whole image. Okay, the increased number of pixels in the region of interest improves spatial resolution. Okay, now we can actually see, you know, the differences of shades of gray, so we can identify the mouth, the nose, and the eyes, the eyebrows and stuff, right? Okay, so which one is better?
Right.
Right magnification. And when does it happen?
before you.
Before you freeze.
Before you freeze, Okay, so if you want to make your images look better, fix them before you freeze. Okay, you might get away with it when you use post-processing, but please get into the habit of doing it before you freeze, because not all machines have post-processing. Okay, so here's kind of a comparison between read and write magnification. Okay, so read uses old data, it is post-processing, larger pixel size. Why is it larger pixel size? We could use them in, right? So it doesn't give it more pixels, it just makes those pixels bigger. Okay? The same number of pixels as in the original region of interest, unchanged spatial resolution, unchanged temporal resolution. Okay, now write magnification. So it requires new data. It is pre-processing, identical pixel size, more pixels than in the original region of interest, improved spatial resolution, and may improve temporal resolution. Why do you think you would improve temporal resolution?
That includes the time, but
Yeah, the time, okay. So, just think. How much time does it take to get information from this whole area
Okay.
compared to the smaller area?
it'll be faster to process a smaller area.
It'll be faster to process the smaller area, so therefore our temporal resolution can improve, okay? I want you guys to understand that it can improve,
Not always.
not always, not always. Sometimes the image is so detailed that it needs more scan lines, and more scan lines equals more time. Okay, you need to know the differences between read and write magnifications, okay? You need to know the characteristics. Okay. Coded excitation. Everybody has problems with this. Okay, so what are we trying to do? What are we constantly trying to do in ultrasound when we're scanning our patients?
Adjust the image,
Adjusting the image to make it what?
better resolution.
Better resolution, okay? With each image, with each structure, with each suite, we're optimizing our images to make a better diagnosis, right? To make an accurate diagnosis, okay? So we can say that we're trying to improve resolutions to be more accurate, right? Okay, so coded excitation is one method that the machine helps us, okay? So this is what's the difference between this pulse and this pulse? Huh?
The amplitude
Okay, so what about the amplitude pulse?
is higher, stronger on the bottom.
Okay, it's higher and stronger than the bottom one, okay. So what do we see here in this pulse? We see one peak right there, right? In this pulse?
Yes.
Yes? How many peaks do you see in this one?
A lot.
A lot of peaks. Okay, so we have one inclination and one declination, right? Okay, how many inclinations and declinations do you see here? A lot, right? Okay, there's a lot more. Okay, what about the time?
It was faster to process the top one and.
Okay, so we can say that the top one has a short PD, right? Okay, what about the bottom one?
A longer peak.
Longer.
A longer PD, right? Okay. So, what is the benefit of that? Because we've learned that actual resolution is better with a short pulse length, right?
Yeah.
Okay, so how does having a longer one benefit us?
Penetration.
Penetration,
Like
Yes.
it improves.
penetration, okay? Penetration, and also if you notice, we have a variance of amplitudes, right? Okay, of frequencies. This frequency is crazy, this one is a little bit more regulated, right? Okay, so coded excitation creates very long sound pulses containing a wide range of frequencies. So this long pulse distributes energy along a broad frequency range. The encoded pulse is strong, but it keeps the peak intensity below the FEA's limit. This improves penetration, okay? So, we do distribute, higher voltages for a longer time, but it's below the standard that the FDA has put, so that way the minor effects are still to a minimum. Okay, so how does coded excitation helps?
That,
Penetration, penetration, okay? So, the coded excitation occurs in the pulsar. So what makes the codes, or what makes the coded excitations? Or pulsar. Does everybody understand that?
Mhm.
What else does a pulsar do?
The amplitude,
Amplitude. What else?
BRP and PRF. BRE and PRF.
PRP and PRF?
yes.
Are you sure?
Yeah.
Yes. Alright, just making sure that you're sure. Okay, so coded excitation uses mathematical computations to make the pulses shorter. These shorter pulses improve resolution. Does that make sense? You're shaking your head, Emily. Why does it make sense to you?
I'm reading. To make it make sense.
Does it make sense to you guys?
Do we have to know the mathematical computations?
No. To me, this doesn't make sense because it's saying that it's sending a long pulse for a long period of time, but then it says it uses it to make the pulse shorter.
I guess cause like in the bigger image, it's like in the longer term, it might be just shorter. That's my guess.
So, okay. So what it's doing is it's using a mathematical computation to identify the frequencies that it wants. Okay, so this is kind of like dynamic frequency tuning, right? Where we get the frequencies, like the higher frequencies for the superficial and the lower for the deeper. Okay, so this is kind of like that, except that it uses a mathematical computation to estimate, well, my focus is at 10 centimeters. What frequencies would I want to use for that? So it's just going to send out this part of the pulse instead of sending out the whole pulse. Or it's going to be superficial and we're doing the carotid and it's going to send out a shorter pulse because the frequency needs to be higher to make it look better, right? Okay, so this can be manipulated mathematically by the machine, okay? It'll pick and choose which frequencies it wants depending on where we're aiming. Okay, but what it does is it helps the pulse travel deeper into the body. Okay, so what modality would this benefit the most? Abdomen. Abdomen. Abdomen, right? Liver, spleen, kidneys. They're deeper, they're bigger organs, need more penetration to see the entire image. So if you guys can see the difference between image A and image B, which one is better? B, right? Why do you think it looks better?
That's artifact.
more clear,
Less artifact, less what? What's the artifact to see it at the bottom?
Attenuation.
Attenuation, yes. Less attenuation. And why do we have less attenuation?
More
It's not
It's
compensating.
not penetrating, because it uses the frequencies it wants. So
Because it's sending this very long pulse, right? It has more penetration because it's active for a longer time, it travels more, but upon reception, it'll pick out only the frequencies that it needs to make the image of the diaphragm. Okay? What is it called? Coded excitation. And what does coded excitation do?
More penetration.
How?
With longer pulses.
Okay, so it sends out a longer, more intense pull, right? Pulse. Okay, which penetrates more, and then upon reception, it uses
Dynamic.
equations to pick up the frequencies that it wants to use to make the image. Okay? Coded excitation. Okay, now we have spatial compounding. Okay? So spatial compounding is a method of using, okay. Is a method of using sonographic information from different imaging angles to produce a single image. Okay, so Compound imaging starts by acquiring multiple frames from different view angles. How do you think it does this? Getting the different angles? Beam steering, very good. Right, beam steering. Okay, and how do we achieve beam steering?
Electronic.
Electronically, through what?
The
What component?
The beamformer?
The beamformer, yes. By the beamformer, okay? So the probe will send out the steered beam to the right, to the left, down the middle, and put those images together to make a clear, detailed image, okay? So if you notice here, the beams are just going in a parallel direction, right? Okay, but this image right here is sending the beams to the right, to the left, and to the center. And what did it do? It showed us the tissue behind the cyst, or behind the vessel, right? Okay? So, the more frames in the compound sequence, the better the compound image quality. Okay, so what does that mean?
We want
More,
more angles.
more angles, the better the image quality, so like,
Exactly.
you can see the tissues in the back.
Yeah, okay, so if we have more scan lines in those directions, and we have more frames to put on top of each other, then it turns into the whole image. Okay, have you guys ever used like those trace papers? You know, where you're tracing, then you can lift it up to look at the image and then put it back? Okay, so, like, just imagine having like multiple sheets of those trace papers, right? And from different perspectives, if you put those trace papers all together, it'll be the exact same image as the one that you were tracing.
Like
Okay,
layering, right?
what's that?
Like layering?
Exactly, it's like layering. Okay, now if we have less layers, what happens to our image?
Less clarity.
It's less detailed, right? It's less detailed, so we get these gaps in between the tissues. You guys know what this is?
Breast.
Breast. Not boobs.
Nice.
We are medical professionals, okay?
Pectoral.
I meant to say
Breast.
Sorry.
This is a breast.
It looks like the moon.
Nice, yeah.
It looks like a moon.
There's a- Okay, so compound imaging reduces speckle and minimizes shadowing artifact. What is speckle?
Unwanted noise.
Unwanted noise, okay? Low-level echoes, right, that are unwanted. How do you think it reduces that? By putting actual echoes on top of that noise. And it erases it from that, okay? So it reduces speckle and it minimizes shadowing artifact. How does it minimize the shadowing artifact?
Because of the echoes that it's now compensating for, will reduce the gaps.
Put it into words, Paul.
No.
Paul do this. Okay, that's exactly it.
Angles, yeah.
Yeah. Okay, so if there's something blocking us here, what do? We go around it this way and we go around it this way, right? Okay, so the posterior shadowing gets help from these, from these lines coming in on either side, and we're able to fill in the information that we lost. Okay, so spatial compounding reduces the frame rate and will reduce the temporal resolution, because frame rate and temporal resolution have what type of relationship?
Directly related.
They're directly related. Okay, so why would our frame rate go down?
Because the resolution goes down.
Well, yes. Well, why?
There's less, information.
No, no, no.
That's frames
Less.
for
There's less print per second. Why? What are we doing?
Twitter.
Put it in angles. Okay, so instead of just having these pulses and these parallel scan lines down this way, let's say that we had 4 scan lines this way. Now we have 4 scan lines this way, 4 scan lines this way, and 4 scan lines this way. So how many scan lines do we have? 12. We have 12 scan lines when we were working with 4. Okay, so it takes a longer time to make one frame, right? Longer T frame, lower frame rate, lower temporal resolution.
The lateral resolution goes up.
Hmm?
The other resolution goes up.
The spatial resolution
Uh-huh.
will be improved, yes, spatial resolution will be improved. As you can see by our images right here, okay, and here we have the posterior shadowing artifact, and here, it fills it in, right? Okay, frequency compounding. Okay, so if our spatial compounding was compounding different angles, what do you think frequency compounding is?
Frequencies.
Yes, different frequencies, okay. So frequency compounding is an advanced technique that reduces speckle, artifact, and noise in ultrasound images. Reflected sound has a large range of frequencies. In traditional ultrasound, all these frequencies are used to create the image. In frequency compounding, the frequency compounding divides the frequencies into subbands of limited frequencies, and an image is created with each of these subbands. The image from each of these subbands are combined to create a single image. Okay, so what does that mean?
It's using a certain frequency and it's a combining frequencies.
Sounds like, yeah, like it's combining, different frequencies to create the bigger picture.
But where are those different frequencies coming from?
The noise and
From the body.
The reduced spectrum.
Well, it reduces spectrum, yes, that's the particle frequency compounding. Okay, so when an ultrasound machine sends a pulse out, is it that frequency, is that the only frequency that travels within the body? No, right? Why?
Because of different tissue.
No, we're talking about the pulse, and the frequency of the pulse. Okay?
Because of the bandwidth.
No, so what prevents our crystals from vibrating continuously?
Is that where it gets it from the bandwidth?
Yes, okay, so the dampening,
The backing
the
material.
vacuum material, it's the same thing, right? Okay, so that creates a bandwidth, right? Okay, so let's say that we have a pulse that is 5 megahertz, right? Okay, and let's just say for argument's sake, there's 2 megahertz, and then there's 7 megahertz, right? Okay, so there are these 3 frequencies that are traveling at the same time through the body, okay? Do we want this 2 megahertz frequency? No, right, because what is noise? It's low level echoes, right? It's low level echoes, okay, so this is just gonna create more noise. Okay, this is our fundamental frequency, this is our 5 megahertz right here, which is what we want, right? Do we want the 7 megahertz? It's more intense, right? Okay, the more intense, the brighter the echoes, so possibly the better the image, right? Depending on what we're scanning. Okay, so what it does is this one makes the image of the liver really nice and bold. This one, if it's a patient that has my body type, my liver is gonna be kind of like dark and then kind of bright. You can still see it. And this one, you'll just see the outline of the liver, right? Okay, but what's gonna happen is that the machine's gonna use all these 3 images together and put them together. Okay, so the information that was missed here can be replaced from this one and from this one. Okay, this one will fill in the gaps that was missed in this one possibly.
That's pretty cool.
Okay? Does that make a little bit more sense?
So it uses the frequencies from the bandwidth?
Yes, it uses the frequencies from the bandwidth and puts them together. Well, each frequency, so let's just say that we have a 3 megahertz probe that has a bandwidth of 4 megahertz, right? Okay, so what are the frequencies? So we have 3 megahertz, that's our fundamental frequency, right? And our bandwidth is 4, what does that mean?
So only 4 frequencies.
5 minus 1, right? Okay, so 4, 5, 2, 1. Okay, so each of these will be put into its own category with its own image. And then each of these images will be
Later.
compounded together, layered together, and that'll fill in the gaps that the pictures have.
So each frequency is compensating for whatever the other frequency is losing.
Yeah. Have you seen those artists where they draw like
Oh, yeah,
like
the
a,
old
like
school.
a line, and then they put that line aside, and then they put like another color, and they put that one aside, and then they put like another color, and then they put them on top of each other, and then it makes an image. That's exactly what the frequency and the spatial compounding are doing, just with different things. The spatial compounding is with different angles, frequency compounding is with different frequencies.
And this is something that's the machine does for us?
Yes, it's something that the machine does for us.
Is there a button for it?
No.
Okay, so this can't be controlled by this.
Well, there is a button on different machines. Like, there's a button where it'll say like optimize, auto optimize, or auto correct or whatever, and that's what it is. It's just a bunch of different compounding.
So the frequency compounding is similar to the dynamic tuning?
No, no, it's more similar to the spatial compounding because it's putting the different frequencies in their own group and then making an image with that one group.
Oh, okay.
Okay, edge enhancement. Okay, what do we say that edge enhancement was? It helps define the borders between different tissues, right? Okay, so as we can see here, this is without edge enhancement. Can we tell the difference in the borders?
Not really.
Kind of, but
Yeah, you can.
yeah, you can.
You can, right?
Yeah.
But what happened here?
You could tell them apart really well.
You can tell them apart really well, but what happens at the border?
The white, yeah, it's like a white echogenic one.
It's amplified, right? The white is amplified, and what about the black?
Awesome.
It's also amplified, right? Okay, so at this border, we could see the definite difference between the two tissue types, because at the border, they're enhanced. Okay, remember, it's enhancement. Okay, enhancement means what?
Making it better.
Make it better, right? Bigger, more amplitude, okay? So this is an image processing method that makes pictures look sharper. This method works, I put by. This method works by increasing the image contrast in the area immediately around the edge. Edge enhancement creates subtle bright and dark highlights on either side of these boundaries to make them appear more defined. Okay, so how is this beneficial to us as sonographers?
Distinguishes the
Different
different tissues.
tissues.
Yes, it distinguishes the different tissues, and it could make masses look more obvious. And when I say more obvious, I mean more accurate, okay? Where we can tell definitively that this is a mass. Okay? Temporal compounding. What do you think temporal compounding is?
Distance.
Time. What time? So on the Cine loop, it captures a time frame of 3 seconds, right? So every time that you move the trackball to the left or to the right, you're seeing a different frame, right? Yes?
Yes.
Okay, so imagine we take each of those frames from the Cine loop and we put them together to make one image. Okay, that's exactly what's happening with temporal compounding. Okay, so it's taking a frame in time. Instead of in different directions of space, it's different moments in time. Okay, so from start to end, so So we can see here that each of these are frames, right?
Yes.
And this is a frame. Which one do you think would have a better resolution?
With the more frames in it.
Yes, the one with the more frames would have a better spatial resolution, right? Which means that we could see the structure a lot clearer than this one, right? Okay, but what are we dealing here with?
Time.
We're dealing with more
More processing.
frames, right? So what does more frames do
More
to
processing time.
more processing time, which does what to temporal-
Degrades. the
It
temporal
degrades
resolution.
temporal resolution. Okay, so this is a give and take. Okay, so temporal compounding, also known as persistence or temporal averaging, a processing technique that uses old information from other images. Okay, so they say that we started our carotid artery. Okay, so from the moment we put the probe on the patient to the moment we freeze, it's gonna use all of those frames to put them together to make a better image. Okay, so as we can see here, this one has no persistence. Okay, it has no persistence and the vessel looks like it's not completely filled with blood, right? Is that good or bad?
Bad.
This is bad because this tells me that there's something here that's not letting the blood flow. Okay, so it could be like plaque or something like that.
Stenosis.
Okay, but all we needed to do is adjust our settings, and one of the settings that can help us fill the vessel is our persistence, okay? So we can increase the persistence or the temporal compounding, and it'll use the Doppler shifts from older images and put them onto the new one to fill up that space. Okay, so persistence increases the signal to noise ratio. So what does that mean?
Okay, get
Gets
rid
rid
of the
of
low
low
level
echoes.
echoes.
So it doesn't get rid of the low level echoes.
It
Okay,
overlaps.
so it increases the amount of useful information,
Okay.
okay? And if you increase one thing, the other thing has to decrease, right? Okay, so it increases the amount of useful information.
Does this affect bioeffects? Does it have?
No. No, it's just using pictures from an older time. Okay, the biggest limitation of persistence is a reduced frame rate. And if we have a reduced frame rate, what else do we have?
Degraded,
temporal resolution.
Temporal.
Degraded temporal resolution. Yes, very good. Okay, and next, and lastly, we have fill-in interpolation. Okay, so from here to here, what is this? We have a north and a south. What is this?
It's a line of information.
It's a pole, right?
Yeah.
Okay, so fill in interpolation. So we're filling in the spaces between poles. Okay, so with center-shaped images, the scan lines separate as increasing depths. Okay, so on the curvilinear probe, it starts off, let's say, at 6 millimeters, right? But the more it travels, it deviates and it deviates and it deviates, right? So each crystal has that range of deviation, which creates a space once you get deeper into the patient. Okay, is that good or bad?
Bad.
That's bad, right? Because the more space we have between, the more choppy our image is going to look. Okay, so this is where fill-in interpolation comes in. Okay, so it uses, what do we call it? Like estimated information, okay, to fill in the gaps between the poles. Okay, so interpolation is a method of constructing new simulated data points to fill in the gaps. Okay, so what it does is it kind of averages the echoes between these two poles and it puts it in the middle. Okay, so we go from this heterogeneous looking image to a more smooth image, right? This is a little bit more bistable. This is a little bit more grayscale. Yeah, okay, that's because we have more information between the poles.
And the computer or the system does that for
No.
us.
We could change that with the line density.
Oh,
With the what?
line
With the
density.
line density.
Like what, increasing it or?
Increasing or decreasing the line density, okay? So fill-in interpolation is a form of pre-processing. the line density increases, improving spatial resolution. Okay, so we have more echoes to work with in between here, right? Okay, so what does that mean? If we improve our spatial resolution, what do we degrade? Temporal. Okay, because now we're using more scan lines per frame, which is gonna take longer to interpret the data we scan. Okay, so that improves our spatial resolution, but it degrades our temporal resolution. Okay, so, right, just like you guys, some of you guys mentioned last week, it's a game of give and take. You always kind of have the perfect settings for everything. When one improves, the other one decreases, and vice versa. Okay, so fill in interpolation, temporal compounding, edge enhancement, frequency compounding, spatial compounding, and codec excitation. And read and write magnification.
Yes.
It's not too bad.
Question mark?
Just a moment.
Ooh.